and others, right? So these are just a few examples. Another example is with SFHIP. When SFHIP formed, we decided very important to have the voices of communities representing those communities disproportionately burdened by health inequity, right? And so I'll stop there because I've said a whole lot, but just say I'm happy to be home, one of my other homes here in the Bayview. Happy to be home with all of you, my UCSF folks I see in the audience, my CLI folks, and everyone else who I know it loves and serves the community. So thank you for being here today to do that once again.
Thank you. Fanny?
Hi, I'm Fanny Lam, Executive Director of APA Family Support Services. Is not on. Okay, thanks. I'm Fanny Lam, Executive Director of APA Family Support Services. I'm also the co-chair of Asian Health, API Health Parity Coalitions, and that's why I'm here today. I was born and raised in Hong Kong. Hong Kong is an international city, so we have all races in Hong Kong. I never learned about or heard about the word people of color until I was 17, when I became an exchange student to Kentucky. And I studied grade 12 there, and because I was transferred from Hong Kong, so I need to study all American history at once. And then when I realized that, wow, race issue is a huge issue in America. Even though there's no segregations in the school that I was at, we have 1,000 kids, there's only 3 Asians. And I know that I'm friends with African Americans, I'm friends with white, but they don't hang out. And so I started questioning, like, whoa, what does that mean? Like, the law said this, but in reality, it wasn't like that. The church is separated. People go to different places for a haircut. People go to different places for restaurants. So that kind of ingrained it in me. I graduated high school. I continued my college in Hong Kong, and I moved here 14 years ago with my husband. He's born and raised in San Francisco. And so I started, living here, and I realized that, wow, how come it's always about the colors? How come we have to say this is people of color? We're just people. We just have needs. We just have, different needs in the community. And so when I start working with APA Family Support Services, I realized that, people look at organizations or look at the community in that way, and that's how the city also separate us in that way. Sometimes I feel like, why are you putting us in against each other? We're serving everyone. Our agency 40 years ago only served Asian women, but now we serve everyone. We just opened a new center on Mission, 4377 Mission Street in the Outer Mission, and we serve everyone. We have staff who speak Spanish. We have staff who speak Cambodian, Thai. We have African American staff who serve Sunnydale Mercy Housing. And so I'm really enthusiastic about conveying this message that we are people, we are human, we have needs, and we need you guys to help us. So that's why I'm here today, and I'm really glad that we're convening again, and we can't wait to meet together with all the coalition members. Thank you.
Amazing. What's coming to mind for me right now is multicultural solidarity, right? Because we're in this fight, and we have to come together, divide and conquer, right? Like, if we come together, we are more powerful. And so AACHEC, amazing, right? Started 2008. At its height, had 100 organizations that were part of this movement. Amazing. And so we're relaunching today because it is time. We are not going to be eradicated from San Francisco, right? Can we say that? Black people are not going to disappear from San Francisco. I'm an SF native, raised in the Fillmore, but I'm a second generation San Francisco native. My father, they actually lived in the Bayview. They moved all around. They were in Lakeview, Fillmore, Bayview. They were all over, right? And so we had to break down those silos too, because I believe, in those times, folks moved around. We weren't like Bayview, Fillmore, Lakeview separated like that. We were moving around, and so we want to have solidarity. 5% is where we are in the city. 5%. Thinking about redevelopment, go back to that time. We were at our height, we had 13% black population in San Francisco. We had the Harlem of the West, the Fillmore, right? Black businesses thriving, a lot of amazing things that we had invested in this city. So right now, the moment is now, because I believe, am I the last black woman in San Francisco? That's what I joke with my friends when I say that, but it's like, it's real for me, because when I walk around, I go around town, I want to tell you guys a story. I was on the Muni bus. I had a young woman, young white woman, they were in high school, tap me on the shoulder and said, I don't think you can stand there on the Muni bus. I was standing by the door. I've rode the 22 Fillmore all my life. I'm like, what? So I was like, no, I grew up here. I know what I'm doing, right? So this is what we're dealing with, right? We belong here, and we have to put our stake in the ground and say, we are here. We are going to stay here, right? Come on. We are not going anywhere in San Francisco. Black people, we bring vibrancy, we bring culture, we bring so much to San Francisco. We don't need to beg for nothing. We bring so much to this city. We built this city. We built this city, right? So right now we're at a crossroads. You know, we've had a change in our administration. We're always in a crisis in San Francisco, right? One crisis or another, whether it be the budget, whatever. We cannot balance the budget on the backs of our community. We cannot cut equity. We cannot cut the hard work that we did. Everyone was like DEI, DEI. People had whole positions created in their companies for DEI. Now, all that's being wiped away. What's going on? So we in San Francisco have to stand up. We have to get organized. We have to come together, because together we are powerful. We are powerful when we come together. So thank you. Yes, we are powerful when we come together. And this is a moment. As an SF native, I worry about our community, not just as the executive director of Rafiki Coalition for Health and Wellness. Shout out to our staff who are doing amazing work out there, to our board, our board chair, Dr. Carolyn Scott, right there. Shout out. This is an amazing organization. We're at a crossroads because I feel like they keep moving the goalpost, right? We get momentum, we organize, we had all those wins. You look at the news, I know you guys see the news, what's going on. That's not all of us, right? But they want to treat us like we're a monolith. Like it's all of us, we're all doing the same things. No. Rafiki is amazing organization providing free complementary medicine, holistic health, unheard of, right? For free. We have to preserve these services for our community. We deserve it all. You know, when they want to talk about scarcity, we got to be in abundance. We deserve it all. And we are at a crossroads. And this is about multicultural solidarity, because that's how we win. That is how we win. Not being separated, no divide and conquer. We're coming together. Black, brown, Asian, we're coming together to organize against this wicked budget that they're putting in front of us. $20 million of cuts. That's what they're talking about right now. 20 million, 400 million for the city of San Francisco. That's not our problem. Why is that got to rest on our backs? Always. So we're getting organized. That's why we're having this amazing launch today, because divided, we will not be, we will fail if we're divided. We will fail. So we got to come together. We have to organize, and we have to be strategic. Sorry, Tracy, I went over.
It's all right. You are just saying what needs to be said, so we appreciate you. So I would love for you guys to share some history when you think about your individual coalitions. Tell us a little bit of why it started, who started it, when, whatever you want to share around the history of your coalition. Roberto, you can start.
Thank you. So the CLI coalition I should say, is really the continuing work and advocacy of many community leaders. Okay, so just looking here at this table of powerful women, right? You know, Tracy Brown, who's currently down at City Hall, and on the board of MLDS.
Tracy.
Gloria Romero, who's currently leading Instituto Familiar de la Raza. Selena Lucero, currently leading Horizons Unlimited. Claudia Leon, part of our leadership at Instituto Familiar de la Raza. So these organizations have been leading voices, MLVS, IFR, Horizons, since decades ago, right? Since we were children, and they served us, those organizations. They benefited us and our families and our peers. So this coalition is really a coming together of organizations and leaders that have always stepped up to serve and spoken up for our communities. It came together in this particular constellation of organizations about 15 years ago, if I remember correctly, and that was under Director Barbara Garcia when she was directing the Department of Public Health. And she was very concerned that there were tremendous health disparities impacting communities of color, and wanted to ensure that the Department of Public Health was engaging with community leadership to get community input about how they should do things. And so asked community leaders if they would come together as health equity coalitions to be that representative voice. So from my understanding, that's how we came together in that coalition. That's how AACHEC came together, and that's how API Health Parity Coalition came together. Over the years, I've seen us together as three coalitions be at the SFHIP table and other tables. And it, you know, it's always a struggle, right? Because as folks have said here, when the city cuts all the different programs that serve our communities, it's often cutting community-based organizations first before cutting city departments, right? Or other resources. I work at UCSF. We're experiencing tremendous cuts. I know the city is experiencing tremendous cuts. But I'm very clear that the community-based organizations always have to do more with less than what we do in those well-resourced institutions. So it's been a challenge to stay together in those coalitions without funding to do that coalition work, right? It takes work to meet, to plan together, to do things together, to publish reports together, et cetera, right? So it's been a challenge over the years to continue to do that. But I think we remain committed to the work, committed to making sure there's a representative voice, especially advocating around policy, right? So we have other coalitions advocating in other ways, but advocating around health policy, I think that is kind of where we have a niche as a coalition. And one example of where we came together to advocate around policy was with the soda tax, right? The soda tax, and I'll be honest, you know, when the scientists began talking about this at UCSF, and when we first went to the community to say, we got this great idea, folks said, we ain't got time for soda. We're dealing with housing crisis, violence, right? Many struggles. We don't have time to trip off of people's soda, right? Totally understandable, right? But when we began to map out, okay, because we have all the data, we can see on this map who's drinking more soda than others. Check out this map. Where is the uncontrolled diabetes related hospitalizations? Same places. Look at this redlining map, okay? How were people impacted by redlining? Same communities, right? Look at this map of poverty. Look at this map of obesity. They all overlay together, right? And when we did that, we also said, and here's the statistic, you know, homicide makes the headlines, but check out the numbers of people dying from diabetes, cardiovascular disease, heart attack, right? many, many more people than homicide. And so we do need to pay attention to that. And we did need a policy to help us do that. And we needed a policy that would generate money for community organizations like the Bayview Y trying to do a walking group, right? Because there's not a lot of money for that. We spend a lot of money on treating sick people. That's the model in this country, is to pay for surgery, medications, because that's where the profit is, right? But if you gotta pay to keep people healthy, like other countries that they provide free health care, they're more invested in preventing illness, preventing disease, right? So that's what the soda tax was about. It required community voice. It required especially community voice around how to spend that money. And so there was a moment when I remember communities, all the coalition members saying, we demand that at least half that soda tax goes straight to community-based organizations, right? Because the city, they want to put that into the city budget as much as possible. And right now, that's what they're really planning to do over the last several years, right? Is saying we need to put that soda tax dollars into HSA. I understand they're dealing with budget cuts, struggles, but I also understand the community has interventions in mind, and the community is really interested in making sure that that money that's coming out of communities of color goes right back into communities of color to employ folks in those communities to do the interventions that they want to do to help keep people healthy. So I've been hearing that from all the coalitions, from all the community-based organizations. I think they're right. I think it's a great idea. And I think that this is an opportunity today to re-engage in that conversation among many conversations.
So, my mic is not working. So for API Health Parity Coalition, we actually started around same time, 20 years ago, with the position paper. Is it better? So with the position paper, and we actually have direct support from DPH in those days. Director Barbara Garcia actually have grants to support us to create multi-languages PSA, which we really needed because we have over 20 plus agency in our coalitions. We have, community members speak over 20 plus languages. However, as time goes, we continue to advocate, but all those resources were cut. It's the same questions, right? Why us first? And then we kind of lost touch with DPH, and I'm really happy now that I feel like DPH is back interested in listening to us and interested in listening to the voices. Even though there is cut, I think there's hope that we can continue to advocate. We are also part of the soda tax. We are also aware that even though it was said that there is supposed to be an equity seat for each equity group, it's not happening that way. No matter how many letters that we wrote. So we do want everybody to be together and to advocate for that. We are recently also working on a project that is focusing on populations and sexual health issues that DPH wants to know more about how the outreach effort is. However, there are also some other sickness like Hep B that is particularly prone to Asian Pacific Islanders population that were not asked in the questions. And so those are the things we continue to communicate with DPH about. Well, when you do those surveys, you are giving out, I don't know, maybe $300,000 for consultant to do those work. Can you just include those kind of illness that particularly prone to certain populations so that every information is captured through the survey? So those are the things that we do as an API-HPC, and we're really continue to do it. And all of us here are volunteers, and we're really struggling to get to meet together, but every time we meet together, we learn something new. So I'm really happy about that. Thank you.
Thank you.
Yes. Yes, so I feel like Maxine can give a better history than I can. Where's Maxine? Shout out to Maxine. Been with us for almost 20 years at Rafiki. Shout out to Maxine. I know she's shy. She's a bit shy. And then I also want to shout out our leadership circle. So to sing, Majid, Brittany, Jonathan, give them a shout out. Thank you. Thank you for joining and being part of this. I am thinking about the data. When you look at the community needs assessment from 2025, it's really sad, y'all. 5 times Black, 50 years old, 5 times the rate of overdose. Then you look at the chart, it's like beyond every other racial group. I mean, heart disease, beyond every other racial group. I mean, the data is clear. So we have an imperative. You know, the city has to act, because folks are saying we want to be data-driven, right? We want to make decisions based on the data. So the data is right there. Black folks in the city have the highest disparity in all categories, right? So where's the action? How do we push folks to say we need to prioritize Black bodies? How do we get that to happen? So that's why we're relaunching. And over time, I mean, AACHEC, we have invested in policy work, really looking at how do we move forward health policy in this city. But if you look at the data, I mean, premature birth even, you know, that hasn't changed. I worked for the Preterm Birth Initiative for 10 years at UCSF. That word still is getting higher now. But folks gotta call out the elephant in the middle of the room. It's structural racism, right? We can't say racism. We gotta say racism. That is because it doesn't matter your economic stance, doesn't matter your education. When you look at maternal health, still the same outcomes. Still the same outcomes. No matter if you're a wealthy Black woman, master's, PhD, still going to the hospital being treated with disrespect. Look at Serena Williams. Look at Beyonce, right? Same outcomes. And so for us, we really want to focus in on how do we get the city to act. Because I know folks are talking about reparations. You'll hear about the reparations panel. You'll listen to the reparations panel later today. But how do we get the city to act when we know the impact of redevelopment? We know the impact of police violence. Black folks, we've lived through multiple pandemics, right? We've lived through the police violence pandemic, COVID-19, and before that, where Rafiki was started, the AIDS crisis. So we've lived through multiple crises. And so it's really about pushing the city to act. How do we get folks to say, our lives matter, Black lives matter? How do we get them to understand that? Because the data is clear. The data is there. We don't need to do another study. We don't need to do more research. The data is clear. So right now, I love, shout out to Nolan, shame and consequences. That's what we say with the politicians, right? Shame and consequences. Because what else are we gonna do to get the city to act when we know the data is right there and has been there for years? So that's what we're doing with AACHEC. I would love for everyone to be part of what we're doing, because the time is now.
Yay. Okay, so you guys kind of touched on where we were going with our next question, so I want to kind of stay with it. Thinking about the community health needs assessment, right? And what we know, what we've learned, and you are so right, we do not need, we know the answers, right? We know what the issues are. If you had to choose, when you think about your prospective coalitions, where would you want to focus? Where are you seeing, thinking about some of the gaps and some of the health concerns, what do you think is most critical for your coalition to work? I know there's a lot, but if you had to pick, what would you choose?
I would choose 2 things. First, data desegregation, right? Like, we are grouped as Asian, but we are a group of 20 plus population ethnic groups that speak different languages. I actually don't understand Japanese, I don't understand Korean, I don't understand Cambodian, but they group us together. So we have different culture, we have different practice, we have different health issues, but they just want to mass it together because it's easier. And we have over 35% of population in the city of San Francisco. The second thing we wanted to advocate is data for children and youth. Health data In the CHIP process, in the CHART report, the Community Health Needs Assessment report, DPH also do one. And the latest one that they did was 2024, released in 2025. They only mentioned 2 paragraphs for youth and children. There's no data release. There's no preventative that how we can help children to grow up healthily so that it doesn't lead to the crisis when they grow up, including drug addiction, chronic disease and all that stuff. And so those are the 2 main things our coalition is advocating that DPH really needs to look into and support the community with.
Beautiful. Thank you. Thank you.
A couple of things that I know my colleagues at CLI have raised about the CHNA is that similarly, as you say, that folks are all grouped together, right? And that doesn't tell the difference in story between folks like myself who were born and raised here, right? And folks who have recently immigrated, right? And there are tremendous differences in the needs, in the health status. So, for example, folks born and raised here, the longer we are here in this country, the more we eat like people in this country, right? The more we suffer the consequences of structural racism, right? Folks recently immigrated bring a different diet, right, from their home countries. They bring a stronger sense of identity, right? And folks born and raised here will say, man, as folks of color, we suffer under this structural racism. Folks recently showed up, said, man, this is a place where I can get a job and send some money home, right? So for them, it's a tremendous opportunity. So, but the other piece that is missing is for those folks who are immigrants, and in many cases, those of us who are not, folks are feeling targeted, right? I feel targeted, but I don't necessarily feel afraid to show up to the doctor's office, right? But folks who are from immigrant families and communities, they do feel afraid to go out into public, right? To access food, to access healthcare, et cetera. And that story is missing from the CHNA. So if the CHNA says, the Raza community, they're pretty healthy. Yes, but what about the current environment we're living in where we are seeing immigrant folks not wanting to show up to the doctor's office, not wanting to show up to school in many cases, right? They heard ICE is out today, so they're not sending their children to school. So those kinds of political dynamics are not reflected in the CHNA, but they are important context to understanding what's going to be happening with the health of the Raza community over the next several years. So I know that's another really important piece for us that we have communicated to the leadership of DPH and want to continue making sure that it shows up when people are considering the health context of our community.
Thank you.
Thank you. Definitely the overdose data is really concerning. I have folks in my community last year, beautiful young woman lost to overdose. Definitely want to dig into that, but I'm part of a council. We definitely need to deliberate on what we want to focus on, and that's what the design sprint is going to be focused on, is like, where do we go from here, whether that be mental health, chronic disease, housing. These are big issues. These are big social determinants of health, right? Housing is a major one. And some people feel like it's an intractable issue that we can't deal with because, the rents are going sky high. As we see AI, downtown's coming back, more folks are coming in. It's like almost like the .com 3.0. I don't know which one we're on at this point. We've had multiple .com booms. And so I really want us to think about, very low income housing. What's happening with housing authority? right? Like what's happened with RAD, the redevelopment, the restructuring of housing authority, because that's our extremely low income housing stock. And that's what we need more of. When I look at BMR, you know, you gotta fit in between those limits, right? And, you know, I think 3 times the rent is what you need to be able to put down on a deposit. So it just feels sometimes like, how do we deal with this housing piece in San Francisco? That's a big issue. I would love for us to look at it with AACHEC, but it's big. And the market in SF is going sky high. I mean, a 1-bedroom, $3,700 right now, y'all. 2-bedroom, $5,000. Imagine putting a deposit on that. 3 times the rent. You got to have $15,000 to put down on a deposit. If you want to have your kid to have a room, and you have your room, like $15,000. So we got to figure this out, the housing piece in SF. Of course, there's the legacy of the shipyard, right? And what's happened there, what's going to happen with the shipyard and that piece. I know there's housing that's going to be built out there. But yeah, I really want us to focus on housing, and I want us to focus on the overdose crisis.
Good ones. Thank you. Okay, so we're going to wrap up, but we're going to wrap up with this last question. Can you all speak to why now, and why this multicultural coming together? Why is it important for us to be on one accord and do this work together?
So I think that now is the time, because AACHEC is calling us together to do it, okay? And the reason I say that is because I had the benefit of having relationships with folks in the API Health Parity Coalition, having relationships with folks at AACHEC. So I was like, it's time now, let's get together, Joint Health Equity Coalition. And everybody was like, you gotta slow down, we gotta build relationship, get to know one another, right? And it's true, it's absolutely right, right? But all that to say, I've been ready, I've been wanting this, and so now that you all are calling for it, I hope this is the time, okay? But I gotta respect the wisdom of my elders. Yes, we got to work together, get to know each other, meet together, develop a relationship. Relationship is critical, it's important. You could say we're from this organization, our organizations have worked together, but if we don't know each other as individuals, that's not gonna work. So I'll respect the wisdom of my elders, which was, let's get together and have food together. Let's have music together. Let's get to know one another. Let's try a little project here, little project there. Let's do it. But let's do it, please.
Yes.
Actually, I think the coalitions, all of us were pretty close together before COVID. Because the COVID hit, everything kind of stopped. And then after that, all the organizations struggling to recover and help the community to recover. And so I think this is a good time where we are now seeing very clearly what is happening in the city. I appreciate that the city actually give us warning about budget cut, because 2-3 years ago, there was no warning, it was just cut right there. And so it gives us more time to discuss, to talk, to reflect our feedback to the city. With all the great leaders here in this room, I think it's also a good time that we want to work together. We're willing to spend time together. And there are leaders out there that I believe that they are willing to listen.
I will say ditto to both of what you said. Yeah, I think that for me, I see this is an inflection point. You know, 5% Black population in San Francisco. There is a real risk, given the disparity data, given the housing crisis, given all these factors, that we may not, you know, sometimes I can walk around the city and not see another one of us for a while. And that's heartbreaking as a San Francisco native, as a black woman. So I feel like the moment is now. I want our population to go up. I want people, black folks, to feel like, yes, let's clap for that, yes. Can we get the black population up in San Francisco? I want folks to feel like SF is a place they belong, that we belong, to not feel uncomfortable. We walk around, when we go to, restaurants, when we enjoy the city, we deserve to have, joy in this city. And sometimes it's hard to find that joy as a black person in this city. So I want our population to go up. And I'm thinking, did I answer the question? I feel like I'm riffing off.
Why is now?
Yes, so population go up. How do we make it happen? How do we make this a space that black people want to come to?
Okay, so we wanted to leave some time if anyone from the audience wanted to make comments, ask questions, we welcome them. So I'll be a mic runner.
Dr. Gina Fromer, President and CEO of Glide. I've been around for a long time. I've seen coalitions come and go. Seems like the Black coalition always goes. I want to have a comment. I don't think we will get anywhere unless the Latino coalition and the API coalition says, this is wrong, black people need this. Like, you have to stand up for our rights too, for what we need. Because what happens is with this divide and conquer, it becomes, okay, we gotta stand up for our own. Then we get back into our silo, right? It's not gonna work unless Roberto, this coalition, and Fanny, they says, this is, you see what the numbers say? Black people are dying, this is wrong. That you stand up there and say it's wrong, you stand up there and say it's wrong, it is wrong. We're gonna stand by the black community and say, this is wrong. This, coming together is great, but it can't just be for your own. It has to be, we're the ones that's dying, we're the ones that's victim of all of this. Look at the numbers, they don't lie. I'm sitting in Glide, I see it every day, right? Who's dying, and there's not enough money supporting who's dying. But you know what I mean? Come together in that way. We say we come together, but then at the end of the day, we're not standing up for each other. I will stand up for the Latino Coalition, I will stand up for the API Coalition, damn sure gonna stand up for a Black People Coalition, but we have to do it together in that way. Because otherwise they're gonna keep dividing and conquering us like they do with the money for decades. I've been around a long time.
Yes.
All right. Anybody want to respond, or do we have more comments? Okay.
Hi, I am Novani. My question is about the Black population. I am Black from another country, and I would like to understand the 5% Black in San Francisco. Does that include Black from other country? Because when they ask you to fill out paper, it's hard to find out exactly where you fit, because it's usually said African American, and it's hard for me to say that I am African American because I have never been to Africa, and I am from Haiti. We are multiracial. And now when you said about that, so I don't know if they count Black from other country in that 5% in San Francisco. And furthermore, from what the person that just spoke about said, it's like when you talk about African American coalition, does this also include Black from other country? Because there is that misunderstanding, or most of the time, Black from other country to feel that they are not counted, and even if they come in, and it's hard to integrate, because from a cultural background or social or education or something like, or language too.
Yes, thank you for that. And we need to look and see how that 5% is comprised. I can't speak to that, but you are welcome. You know, the whole diaspora is welcome in AACHEC. We are all one community, one family. I just want to say that, the whole diaspora. Yes, but we need to look at the data.
Absolutely.
I'm not sure.
Yep. Anybody else?
Good afternoon. I'm Alice Davis, and I will be 87 this month. I have my son and my daughter living here in the city. I buried my youngest daughter, but I have lots of grands. And when I came down the aisle and I heard the beat, I couldn't help it. I was dancing and crying, because I've been through this racism that you all are talking about. On my job, sometime it was the black sergeant in the police department at the airport that did me the worst, you know? So I wanna help clean it up for my grandbabies. I got some great grandbabies now, and I wanna clean it up for them. I'm a native Californian myself. I grew up in Bakersfield. That's where I was born. Now you can imagine what that was back then. But my mom and dad, they had 2 or 3 homes for us and big yards for us. And I want to see these young people have some of that. You know?
Yes.
We had, our yard was bigger than this. All kind of fruit trees and stuff, you know, gardens and greens and everything. I want to see these young people experience it and know what it is. But the main thing is, let's help them stick together. I'm through.
Thank you. Thank you. Thank you. Anybody else have a comment?
Thank you for that. That was amazing. Thank you.
Oh, thank you. I am also from another country, but I'm from Africa. I was born in Africa. So, thank you. So, I was like, am I African American? Could I say that? And my God, today my brain is like not remembering names. Sorry. Our executive director. We were talking about that, and he just told me, Samira, just put, it's like African American, then put slash East African. So now I just put Black African American. I mean Black East African actually. That's what I do. But also it's like also actually. This is also for AACHEC, and is there, it's like there is, I see that it's we immigrants, or there is no talk in, it's like as if, we diaspora doesn't exist. So I just want also to put that in, even though I'm from Rafiki, I'm myself, I consider myself, it's home for me. I just want to ask that question. Thank you.
Can I turn around and see who I'm talking to? Because I came late. I'm sorry, I came late. I didn't get to scan the room. Hi to everyone that I know, because I've seen a lot of people that I know. So I was really touched by your message about the systemic racism and the immigrants coming in versus the people who are native. Because all of my first cousins are Latinos, Filipinos, whites, and everything. So when you come to America as an immigrant, you end up blending in, and I'm the black one. And I experience black racism. I'm glad to see UCSF in the house because I have issues with the continuity of care at UCSF. I have a really good physician, but none of her referrals are honored. And I've been trying to get treatment for 10 years at UCSF, having Blue Cross Blue Shield, paying the highest premium possible so I can get the best treatment. So please, whoever is here from UCSF, I want to talk to you. Like really, I've been unstably housed for 10 years. I'm a native San Franciscan. I have just had my 5th grandchild. I just had a granddaughter over the weekend. I've been an electrician in the IBEW for 27 years. Why am I unstably housed? You know, why? Why am I unstably housed, still living between my children and trying to make things meet? All these people that are from my community who I know, who have heard parts of my story, I think that we should at least come together and get to know each other better. Because I've been here, I've been struggling, you've been seeing me, I've been participatory, and I need my community to stand by me in all these issues, period. Otherwise, none of these coalitions mean anything. The racial, if we can't overcome our personal issues to represent the community, none of this racial stuff or anything matters. So I'm community. See how I can get help.
Okay.
Thank you. This has been amazing, informative, strengthening, inspiring, encouraging. And as the mother, the sister to me, I too am 80 in a couple of months. But we've experienced the transitions. We've experienced civil rights movements. We've walked them, sat them, helped them, cried with them, and prayed for you to rise up. Prayed, we still pray. And I'm so grateful to see you here and to hear where you are. Many of you, I've walked with your moms, your dads, uncles, aunts. And so my question is, we do have, Madrid is here, and there are others, services that are helping to bring people back from across the nation into this city with affordable housing. We need for you to come to our meetings, know as leaders what is available. What is available across our cultures. We're helping everyone. But there are special programs and projects where they're seeking those that have a certificate of preference. That means you were born, raised, but can't afford to be here. So you've left, but you grandmother now. Unstable housing. This young woman and others, we have got to learn as leaders and not just keep moving because we're okay, or almost okay. Know the programs. Know how to plug your people into them. Go to your churches, post up the information. Call for updates. Madrid is here. He can give it to you. But when we don't know everyone gets the benefits, they move here from New York, no one's put in for it, not enough people, they get the plug-in. We even have help for first-time home buyers. Shanell gave you the figures of what you'd have to put down. We've got programs that help you with that. And we've got young people that are getting into their first-time homes. And one of the greatest historians is in our midst. I just see her now. It's our commissioner, Linda Fadaki. Call her. She can tell you everything that is available from mental health. She's helped build these programs. Health care, she has helped build these programs from Africa. But she has been here for years and years. Dr. Jackson, he's helped build the programs, and others that are here. What I'm saying is we must, as it's been said, come together as leaders and walk out the door with more information than what you had or have at this moment. This is a season And we're called together for such a time as this. This is not just a meeting.
Ashe.
We don't have time for it. But thank you, thank you, thank you. Learn, find out what's available. Rafiki here, and so many still don't know about, as Shanell so nicely, graciously put it, free, top quality that you might not get in a clinic where we're paying the highest amount, but quality services for health and wellness.
All right. Thank you.
Yes.
Should we wrap up? Oh, yeah. We'll take one more, and then we'll wrap up.
Hello, family. Come on. Hello, family.
Hello.
All right, let's wake up a little bit. Let me talk about health and wellness in the African American community, if I can, for a minute. One of the things that we have to understand is that this drives us. Not this supports this. We are about our mental health. What we manifest is what we are. If you talk about issues in the African American community and you don't talk about anxiety, you don't talk about depression, you're missing the boat. Everything starts with the fact that we have post-traumatic syndrome. Not post-traumatic, excuse me. We have traumatic stress syndrome, excuse me. Brain works a little slower when you get almost 80 like me. But anyway, the thing that I want to try to impress upon our community is that understand your nature, your genetic nature is one of love. We are a communal people. We have sayings like, we're only as strong as our weakest link. We're in a system that says that I have to compete to eat. And if you think about competition, competition means that you have to eliminate. That's violence, that's hate. I'm talking about let's flip the script. Understand that when you have to compete, that you're in a hateful environment, your mind is in a violent environment, you cannot grow, you cannot create when you're in fear of your life. If you had a fire, would you throw another fire on it? What you would do is you would counter it with something that counters it. You put water on fire, in most cases. I mean, you can get technical. But the thing is that we as a people got to stop all this hating, because all that's fire. What we need to do is we need to flip the script and take them back to the communal, compassionate of humanity. We're about compassion and love. We're not about hate. And when you flip that script on us, we become some of the most dangerous people on the planet. We don't need to hate back. We need to love harder. And if you think about the strategies that we could have when we think communal, if we came together as the African American community in America, we would be the 14th largest economy on the planet. But we are in a system that divides us because it makes us compete against us. We have to flip the script and go back to being communal and collective economic mentalities. It's like I can go out here and eat steaks and everything I want to, but if I was with everybody else, everybody could eat steaks. If you just combined your meals, if you took your food stamps and put them together, all of you would eat like kings. Because now you have the economic formula that gives you the ability to go out and be mighty because you got the unity. When I'm out here, I can be bad, I can be Michael Jackson, I can be Michael Jordan, I can be Michael anybody I want to be, and be great because we're a great people. But how does that help the rest of us? We have to start thinking collectively collectively is compassionately, and when you really want to break it down, it's like we got to start loving harder. As regardless of how much hate, you do not fight hate with hate. And I want you to understand that you manifest what you are. If you don't understand that everybody on the planet is imitating you, the world wouldn't know about fried chicken and mashed potatoes if it wasn't for the African American community. We wouldn't have been to the moon. We're one of the greatest ethnic groups on the planet. Stop letting this monster deceive you into thinking that you're worthless. That you walk out of the house and you constantly have to think about the competition against you. That is a mental health problem. Flip the script, community. Love. Let's start a love-evolution, and that's from Dr. Haynes. God bless all of you.
Thank you.
Okay, thank you.
Can I say something
yes.
briefly? I'm sorry. Thank you, Brother Cedric. A couple things come to mind in what you say about this need to tap into the collectivism, right? So I was in China a couple weeks ago, and everybody eats together, right? Round table, spinning around. And they asked me about, they say, oh, we always, when the soup comes, the meal's over, because they bring dishes nonstop, right? How do you all do it in the U.S., right? And I said, man, I'm so embarrassed to say, we each have our own plate. We're very individualistic in this country, okay? When I went to Senegal, and I saw everyone eating from one plate in the center of the table, and then me and my homies each had our own plate. I said, man, that's embarrassing. We are so individualistic because of how we've been conditioned in this country, right? And so seeing the world and food and how we relate from another perspective was really helpful to help me understand that. So I want to say that to say, I really feel that idea today of the need for us to work together and collectivism. And in that same spirit, I want to also respond to Dr. Fulmer, your challenge, right? That we need to speak up against anti-blackness, against racism, against black folks, right? And I know we do some of that work in our community because a lot of folks don't know, but more Africans were brought to Latin America than were brought to North America, okay? So we are very black, right? There's some differences because we were allowed to intermarry, and that didn't happen in North America, so we blended more, right? But we also have anti-black racism in Latin America such that our families try to hide that when we have African, right, for example. So we're doing work in our community. I'll just give an example. So my colleagues here from Instituto Familiar de la Raza, the staff there said we need to have policies and an effort to look at how does anti-black racism show up in our organization, and how do we overcome it, right? We spent years working on that. We got a lot more work to do still. I'm not saying we're done. But I'm saying we're doing some work on it, and we gotta do more. I acknowledge that. And outside of our community, yes, we gotta stand up for black community as well. And so I accept that invitation. I know my colleagues do. I know my colleagues are doing that work. And please call us on it when we are not doing it enough. Reach out when you need us to do it on a particular issue. And I accept the invitation on behalf of my colleagues. I know that they're down. And let's do this. Thank you.
Thank you. Thank you. Okay. Still on? Let's give our panel a round of applause. We can wrap it up. Thank you, guys.
Everyone. Thank you so much, everyone. We're now going to take a little break. We're going to be transitioning to our community design sprint. We're going to hear from you in terms of what AACHEC should prioritize in chronic disease, mental health, and housing. So we'll take a 5-minute break, and then we'll go into our breakout groups. Thank you. And give everyone a round of applause. Thank you, Tracy. You're amazing, our amazing moderator.